Happy Friday, everybody. Welcome to everybody's favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's episode, first off, Taylor Swift, plastic surgery rumors. Did she do it? We're going to tell you. And then next, 20-year-olds getting facelifts. Is this for real? We're going to talk about it. And then finally, why do we need sleep? It's an age-old question, and we're going to break it down for you. It's all coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk. An honest and uncensored show about plastic surgery, health, beauty, and lifestyle with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for tuning in. We really do appreciate it. Please hit that like and subscribe button. Turn on those notifications. I'm your host, plastic surgeon Dr. Bruce Hermann. Back with me is Sarah.
Hi.
How was did you go on a trip last week?
Yeah, I went to a wedding.
Oh, a wedding. Was it good? Where'd you go?
It was like in Sherman.
Oh, Sherman. Oh, so not too far away. That's cool. Awesome. It was good?
Yes.
The marriage happened?
Yeah.
They didn't run off? Okay,
yeah.
Good. Brenna, how are you?
Doing good. How are
Yeah? Doing good. It's Friday.
you? It is.
Fridays are always good.
Yes.
And we're talking about one of your favorite people today, Brenna.
Yes, we are.
Thank you. And you actually sent me that one, so
I
thanks.
did,
Yeah,
yes.
awesome. All right, well, cool. Well, let's roll into it. So, first off, Taylor Swift, been in the media a lot lately with the release of her new album, The Life of a Showgirl. I have to admit, I haven't listened to the entire album yet. As I said I was going to, Brenna, I promise I'm going to, so I'm going to give you full report. I'm going to. But she's been doing a lot of interviews lately, and this has caused a new surge of Taylor Swift plastic surgery rumors, which she's had these before. I mean, she's in the media so much, and everybody's looking at how she looks. I've seen a few articles about did Taylor Swift do this, do that. I personally have never seen anything. Have either you two ever seen Taylor Swift on something and been like, did she have something done?
Yeah.
You did? Okay. What specifically?
Her face just sometimes looks a little tight.
A little tight. Okay. All right.
If that makes sense.
No, totally. It just looks, like a little bit more tighter than
Like
normal.
it looks like very
Yeah? Maybe. Brenna, what do you think?
I don't think I've seen something where I'm like, oh, she's definitely had work done. I just kind of look back and I just can't believe how she's looked the same or just, I don't know. She just has aged well.
She's aging well. Yeah, definitely.
She's looked the same for a while.
Well, and I will tell you, Sarah, I think that you have definitely some validity in that there are a couple times where she definitely looks a little bit different in the face, and we're going to break that. Now, whether or not that's surgery or something else.
I don't think she's had a facelift.
No,
she
I don't.
Gotten, like,
no, there's no way.
Or
Yeah. So the other thing too is fans. I hadn't realized this, but fans have been mentioning that her and Travis Kelce, right? That's his name, Kelce, haven't been in the media a lot lately, and so of course that storms up the rumor mill that she's hiding because she had these procedures done, which is nonsense. I mean, she just came off tour and she's doing the new album. I mean, it's not surprising that she's not been out and about.
Yeah, and I've only seen her appearance at one game so far. Travis's.
She's a busy girl, man. She's out there making a new album.
Yeah,
and
but I also feel like the NFL has made it part of their to not focus on her so much.
Oh, really?
I think
people got tired
annoyed.
of it. Yeah, really.
Yeah.
I don't know if the NFL and Taylor Swift fans merge a lot in the middle. I don't know.
And the Super Bowl rumors, and there's no way that she would ever do that.
Yeah, right. So anyway, there was couple articles came out in the past week talking about did she have plastic surgery, because she's been doing all these media interviews, and one of them was the Daily Mail, and they posted a pic, and at first glance it's almost you're like, well, okay, maybe. So throw up that first pic, Brenna. So this is the one that they used when they were talking about, look how different she looks, and okay, I mean, definitely
like a different expression.
Yeah, there you go. That's it. That's the answer right there. You're exactly right, Sarah. It's just when you smile really big like that, it's going to draw up your cheeks, and so when they were saying, she's had work done because of this side by side, I was like, I don't think so. So what I did is I went and I pulled a picture of her with a little bit more closer to that February pic. So throw up that next one. Yeah, right there. So, in these two pictures, I would say she doesn't look exactly the same, but I think that all of the little subtle differences are probably just explained by makeup and lighting and maybe very, very small, weight fluctuations. I mean, our weight generally fluctuates a few pounds, I mean, even the mighty Taylor Swift, I'm sure his weight's not exactly the same from month to month.
I was gonna say the lighting is definitely different.
Yeah, and she's got a little bit more makeup on that right picture.
Hair's different too.
Yeah, hair's different, which is gonna make.
You can see her eyebrow arch. She has a very high arch on her eyebrow.
Yeah, you know why that is.
Well, yeah, it's from Botox, but
Yeah.
she could actually have her eyebrows made like that.
She could. I think she's
like that.
I think she's definitely using Botox though, because I actually watched some of the video from the interview, and just like with normal facial expression, like when I'm doing like this, I mean you can see. I don't have bad wrinkles, but you can see that they pop.
You
they,
look like a
they pop
cartoon
up, right?
character when you do that.
Like what?
A cartoon character.
When you make facial expressions, like you're going to have some wrinkles pop up, and she doesn't have those, which is kind of classic for somebody who's got Botox. And I think she's 35, right? Yeah. I mean, at 35.
36 in December.
When's her birthday? Do you know?
December 13th.
Oh, 13th. Okay.
Yes.
Mine's
We're the
5th.
same age.
Huh?
Oh, really?
Yeah, we were both born 1989.
Wow. Yeah,
Oh.
Travis too.
20th.
Travis has the same birthday as my dad, and now that's his new favorite fact. October 5th,
Oh wow.
and they're both Taylor and Travis are the same age.
Interesting. Yeah. I was the 5th of December, which, yeah, that's a good one. What was I talking about? Oh, right, wrinkles. Yeah, so she's like 35, 36. She should have some, at least signs of, early wrinkles, which she does. Which means she's probably using Botox. Now, about the tightening, I have this belief, and I don't know this for a fact, but I think that a very large number of celebrities are using skin tightening aesthetic procedures. Not surgery, but things like lasers or microneedling, because I use them and I'm not even, remotely like a celebrity. It's like I use them just because they work. And, for people that their livelihood depends on their looks, they're going to be looking for
the money.
Yeah, they have the money and they have the, the desire to maximize their looks. And I bet you that she's been doing those. I mean, why wouldn't she? It's non-surgical, there's very little downtime, and it makes a big difference. And, we see lots of people in her age bracket coming in and getting lasers or microneedling because, they work. I mean, those products work. And why wouldn't you, especially if you're going to be, your looks are like focused on by everyone. So I think you're right. I mean, she probably has done some of that, and you kind of see that after effect probably, depending on where she is in her treatments, because a lot of those things you can repeat. I don't know about the fillers. I mean, people were saying that maybe she got some cheek fillers. If she did, it's the most subtle cheek filler ever, because
I don't think so. She would look way too different.
Yeah, I don't. she didn't have like that Madonna alien look. Remember Madonna with like
that was
like
scary.
her cheeks. Oh
It
my
was
God.
Halloween.
Yeah, that was.
You should be Madonna, or your wife should be Madonna from the.
Oh my God.
From Alien, from when she's looking
The
like an alien.
Madonna.
Her alien era.
Yeah, that was
That'd be
something.
kinda funny.
So yeah, I just don't see it. I think that people are going to make news about Taylor Swift, and it doesn't matter if she's had something done or not. They're going to say she has, and fans are going to run with it, and it's just kind of this repeating cycle. But I think she's probably doing the very basic things that a lot of people in her age bracket, and especially celebrities, are doing, things like Botox and probably some lasers. But I think that's it. I haven't seen any indication that she's having surgery. I mean, that's all just the rumor mill.
Yeah.
So
She looks good.
she looks great. I mean, she's taking care, obviously,
Go get more Botox if you want.
she's taking care of herself, and it's part of her career, right? I mean, for better or worse, part of her career is keeping her appearances up,
Yeah.
right? I mean,
And we're talking about her, so she's making money right now.
I know we're making money for Taylor. How messed up is that? She
doesn't
should be
need
making
it.
money for us.
Yeah, I know.
That's the way it should
Taylor.
work. So yeah, I'm gonna have to say that no, she did not have any procedures done. Like an empathetic.
I don't know what you're trying to say, to be honest.
What am I trying to say, Brenna? Empathetic? Emphatic.
Okay.
That's what it is.
Empathetic is like feeling sorry for somebody.
Yeah, sorry, I hit my head on the way into the studio today, so I knocked myself until I get the word to come out. Yeah, emphatic. Yeah, emphatically no. So, okay, let me recap this one real quick first. Today we were talking about the crazy plastic surgery rumors about Taylor Swift. She's out in the media promoting her new album, which I haven't heard all of yet. I know Brenda's really upset about that. And she was doing some interviews, and fans noticed she looks different. And of course, the rumor mill explodes of has she had plastic surgery, and they compared these two pictures of her. Unfortunately, she was making completely different expressions, which is the main reason that those pictures look different. So I took her picture today versus earlier this year, but with the same expression, and she basically looks the same. I do not think that Taylor Swift has had plastic surgery recently. Is she doing Botox? Yeah, I think she probably is. Is she maybe doing some skin tightening things like lasers and microneedling? Probably, because all celebrities are doing that. But did she have plastic surgery recently? No, that did not happen. That's just the rumor mill. She's Taylor Swift. People are going to talk. Haters going to hate, all that. Taylor, you go, girl. You look great. If you want to use Botox, go for it. It's good. So there we go. All right. Next.
There's the other. Oh, sorry. Go ahead.
What songs have you listened to? If any?
I just have heard a couple, but I don't know the names. I'm going to listen to the whole album because
it's a short one. It's like not even an hour. There's only 12 songs. It's like 45 minutes in total, maybe 47.
You don't have to shame me, Brenda. I want to hear the album. I do.
Opalite is probably my favorite.
What's your favorite song?
Opalite.
Opal Light?
Yeah, it's the third song,
okay.
Which is Travis's birthstone.
Oh.
And the first one, The Fate of Ophelia, that one's the one that's probably trending, the first song on
the album. I'm going to listen to it, I swear. I actually like Taylor Swift.
I want to know your reaction to the song.
Mine's Elizabeth Taylor, Elizabeth Taylor and Wishlist.
Wishlist, yes. I love
Okay,
Wishlist.
I'm going to listen, because I'm not like a Swiftie, but I do like Taylor Swift. I respect her as an artist.
You've seen her in concert.
I've seen her in concert, yeah.
I haven't.
Tune in.
You haven't seen Taylor? I wouldn't go again because it's just.
I think you should at least once in your lifetime.
I would go to like a private like concert with Taylor Swift if I ever got invited to that. But
I've been to a Taylor Swift tribute.
Wow.
Did you?
Uh-huh.
I bet that was fun actually. But yeah, all right. I'm gonna listen, Brenda. I'm gonna give you a report. Okay. This next segment comes from a recent BBC article, which actually has got me a lot of media interviews. I've done 3 in the past 2 days. It's crazy. This is a segment about 20-year-olds getting facelifts. Brendan, you're 20 years old. Have you ever thought about getting a facelift?
22, almost 23.
Almost 23. Have you ever thought about getting a facelift?
No.
Obviously not, because only a crazy person would get a facelift at 20. Now, we do know that young people, we talked about this, Sarah, you'll remember this, that we've talked about how young people are more interested in plastic surgery than people in, not that you're not young, but like your generation, my generation, right? Like the Zoomers are more into plastic surgery than the Millennials, which are more into it than the Gen X. I don't know what the Boomers are up to. So we know that young people are having plastic surgery, right? And so, when you see another thing about, young people having plastic surgery, I'm just like, yeah, that's kind of old news. We've known that for the last 10 years. That data comes to the American Society of Plastic Surgeons, every year about who's getting what and who's doing this and that. And the reasons for it are pretty simple. I mean, social media, number one. I mean, social media has really kind of fueled plastic surgery and aesthetic procedures because of influencers and people wanting to be influencers and people trying to look like that they're influencers and they're celebrities and like everyone's talking about plastic surgery, so there's no stigma anymore. I mean, and the Zoom effect, like there's a ton of reasons why younger people are getting plastic surgery. And I will tell you that for the most part, like I don't have a problem with a lot of it. So for example, I want to clarify, I mean, if a 20-year-old wants to go and get like a breast aug, I mean, what's the difference between, that at 20 or 25 versus 35 or 40? I mean, there are some downsides to doing it early because, when you go to have kids, it's going to change your breasts. And, if you can do it afterwards, you can only have one surgery maybe. Or maybe like a late 20-year-old who gets a tummy tuck, right? Because they have a few kids early and they're done and they want to kind of get their, pre-baby body back. Or somebody wants to get a nose job maybe because they just, were born with a nose that that makes them self-conscious. Like, I don't have a problem with that, obviously. I mean, I don't think that they need to have surgery. I'm never going to tell someone, oh, you need to have surgery, for this or that reason. But, if somebody has an issue that really bugs them and it's reasonable, I don't have a problem with younger people doing surgery. But when I heard that young people like in their 20s were getting facelifts, I was like shocked. I mean,
it's like facelifts were designed as a treatment for like a sagging face or just getting old. But it wasn't designed to be like a preventable thing.
Yeah, exactly. Thank you, Sarah. That's a very smart thing to say, and you're 100% correct.
Like Botox. Botox was designed for preventing.
Yeah, right. Botox, preventive. Excellent point. And I think that understanding what a facelift, and I use facelift and neck lift almost together because almost always when you do one, you do the other because the incisions are the same. But when you're doing a facelift neck lift, there's broadly two parts to it, right? There's taking up the extra skin, okay? But then the second part is actually tightening the deep structures of the face. So it's like your platysma muscle, like that muscle right here, which falls, it gives people the turkey neck. And then the SMAS, which is basically the aponeurotic system, the structural component of the face. Okay, young people are not going to have laxity of that except in like the most insanely
weight loss issues, stuff like that.
Yeah, exactly. There are some that's very smart. Like you know a lot about plastic surgery. Like you're very impressive.
I've been sitting right here next to you
I know.
for a
Like
while.
you're absorbing like a sponge, learning. Brenda's gonna be next. She's gonna impress her friends at parties with plastic surgery facts. But yeah, I would say that for the overwhelming majority, like 99.99999% of people, like getting a facelift at 20 is absolutely bonkers. Like it's just crazy. In fact, when I was looking at this article, I was like, what kind of garbage plastic surgeon did this to some 20-year-old? And you know what happened? I bet Sarah can tell you.
Yes, they're from Florida.
Almost. They went out of the country. They went to Turkey.
Oh, yeah. Turkey, of course.
Yeah. You were on the right track, though. But yeah, it's like, who would do this to a 20-year-old? It's absolutely crazy. Well, she went and had medical tourism, which is a whole nother topic. You guys know I hate medical tourism, but like obviously they're, some of those places are not scrupulous. And I think anyone who does a facelift on a 20-year-old is very, very unscrupulous.
Well, are we gonna see before and after?
Oh, throw up that. Did you throw the picture up there?
We saw that. Yeah,
It's just that.
Oh,
yeah, but we don't see her what she looks like before.
Oh yeah, I'm sorry. I didn't really think she looked all that different. I guess
I think I've seen this video.
I mean, it's probably popped up on
like
your
a filter. Her like eyes are so big.
Yeah.
I saw her before and I saw her after, and I was like, I mean, she had her nose done.
Know her name?
I forgot. I'll look it up.
Maybe I can find it.
I bet you could find it. 20-year-olds getting facelifts. I bet she pops right up.
It's a BBC article, Brenda. If you want to do a quick search, BBC 20-year-olds getting facelift. So, yeah, I think for the overwhelming majority of 20-year-olds, it's absolutely crazy. 30-year-olds is I think also crazy.
I think people look weird after they get facelifts.
If it's too tight, yeah. I mean, I think that a facelift, just like any other plastic surgery, can be done right, where it doesn't look weird, you just look like a younger version of yourself.
Yeah.
But part of the issue is people want to like overcorrect it because it's going to relax a bit. And so sometimes if they overcorrect it, then it doesn't relax enough. Like Jerry Jones is classic.
I saw a video about Bradley Cooper, and he's had a facelift.
He did have a facelift? Man, I saw an article
different.
Really? I need to look him
up. He looks like Bradley Cooper.
Because I love Bradley Cooper.
He looks like him, but not at the same time. He looks like somebody like took something from him. If that makes
like
sense.
His soul or what?
Yeah, like he just looks like different.
Dude, that makes me sad because I had like a bro crush on Bradley Cooper.
Like
He's like
he was
the
like getting
cool,
old.
good-looking
He was like
dude.
turning into like a George Clooney type, like getting old and with the wrinkles and stuff. He was turning into like a a good-looking old man, and then he like did that to his face, and now his like eyes are really big.
Oh,
and,
man,
like, it's just weird.
All right, I'm gonna look it up.
He just looks too.
We're gonna have
he
like
looks too much like Bradley Cooper now, maybe.
We're gonna have like a really sad segment next week.
Yeah.
But yeah, so one of the questions always comes up is like, what's the right time to have a facelift? Well, that's a variable question. In general, I think even 40s is a little early, but it's a little bit more reasonable. Like historically, it was always like 50s or older.
Yeah.
But you mentioned this, Sarah, and I'm gonna kind of give the exception to the rule of like when a younger, and I'm not saying 20, like because that's insane. I think this girl was 28, so she's almost 30, but I digress. So there are two reasons that someone may need a facelift earlier than like the average age. And one is what you said, massive weight loss. If you say, were 150 pounds overweight and you lost that weight, like you could have stretched out those structural components of your face just because there was enough fat under them to stretch them, right? Yeah. And then you lose the weight, and so you would have actually some of that deep structural kind of laxity that a facelift can correct. The other is there are certain genetics that just predispose people to have a relaxed face. I mean, you guys have seen that where you see somebody that's like maybe not that old, but they have like a really saggy neck or face or whatever. And so, did we lose the internet? Are we still on, Brenna?
Yes.
Okay, good. All right, good. So that would be the two exceptions. And like, so I could totally see somebody in their 40s maybe with weight loss or genetics.
Yeah.
Maybe late 30s, but that one's getting harder to believe, but still like 28 is just too young.
I feel like if I ever got a facelift, I would want to pick an age where it just kind of looked like, oh, she looks
refreshed?
Yeah.
Yeah.
Like I wouldn't want to get a facelift and then people be like, she got a facelift.
Like getting it at 70 or something?
Yeah.
Yeah. So I mean, so maybe the right time is, maybe like your 50s, I mean, I think 40s is a little young.
Maybe 50s. I don't even know if I was like 100% gonna get a facelift.
Yeah.
I don't know if I would wait till I was 50 years old.
I would tell you this, like if you do maintenance stuff, like you can totally put that off. Like, we were just talking about this in the last segment, like things like lasers and microneedling. Like if you do maintenance stuff to your skin, then you're gonna absolutely put off the time to when you need a facelift. Now, the only thing is like the deep structural components don't get tightened by those treatments, and that's why they don't work as great on people who are older. But for people that are, 30s, 40s, 50s, like they actually work pretty good. I used the laser, I've said this many times, I used like one round of it and I was like, holy crap, like that actually did some work.
Yeah.
And people are always
like take off like from being outside for like 2 days or something. Right?
Yeah, well, it's a few days more than that, but it's not bad. It's not bad recovery at all. You haven't done one, have you?
No, you said I could, but
you can do one if you want. Yeah, we'll do it. I'll do it and we can video it or something.
Okay, I found some other photos, but no before. So it says she's actually 28. I know that's
28.
That's still pretty young, but here's one of her, I guess, during surgery.
Yeah. I remember the video that I watched. She was talking, and she goes, "I just wanted to look my best. I just wanted to look and feel my best."
I mean, she still looks 28 to me. Like I don't necessarily.
Yeah, she still looks. I mean, she looks great. She looks.
I mean, she does look good, but she's 28. She's gonna look good. I mean, I just don't get. In fact,
she looks very pretty.
In the article, she said that she said it was like a 6-month recovery. Like it was some insanely long recovery because she had like some muscle or some nerve issues afterwards.
Whoever she's married to, man, is lucky because she's always gonna look that age.
Well, the thing is,
she's never gonna not let herself not look that.
Oh, right, yeah. If she's getting this at 28, yeah, she's gonna be like neurotic in like 10 years. Like when things really start going downhill.
Like
she's gonna,
Dolly Parton will wear she wears gloves to cover her hands so
wrinkles,
you can't see her wrinkles.
Hands are like one of the things.
She wears like a bodysuit that comes up to here that like.
Yeah.
So her chest, you can't tell.
I'm just gonna laser my whole body just as I get older.
Yeah.
Kind of keep things together.
This one was also on the article. I don't know.
Yeah, that was the other girl, and I think she looks weird. Like in the right picture, like
her chin looks kind of lopsided.
She kind of has like that alien look almost.
Yeah.
Yeah, I don't care for that. She went to Turkey too.
It looks like she was like, make my face skinny.
Yeah.
Mm-hmm. That's what
she said. Make me look like the gray-faced aliens, like have that triangle head. She has like that Madonna look.
I mean, I think she looks pretty, but she definally looks
different.
Not like
Doesn't
her.
look like herself. Yeah.
No. I think she looks pretty though.
Yeah. Okay, let me recap this one real quick. So today we were talking about this totally insane article on the BBC talking about 20-year-olds getting facelifts. What? I just can't even believe that. Now, we do know that young people are getting plastic surgery and non-surgical aesthetic treatments at a higher rate than previous generations. Why is that? Social media plays an enormous part. Zoom effect, people seeing themselves on Zoom, all the influencers, the increased accessibility and affordability. So young people are getting plastic surgery, and I think in a lot of cases it's okay. Like if they want to do a breast lift or fix their nose if they have some issue, I don't have a problem with that. But a facelift, what in the world? Who's giving facelifts to people in their 20s? They need to lose their license. Well, come to find out, these people are getting their facelifts, of course, in Turkey, where they'll operate on anyone for money. So that would kind of explain that. But Why should a 20-year-old not get a facelift? Well, facelifts are designed to not only tighten skin, but the deep structural components of the face and neck. And 20-year-olds are not going to have laxity in those tissues, except for very, very extreme cases. Example, like genetically, if they're predisposed to that, and they've had a massive weight loss of maybe 100 or 150 pounds, maybe someone younger than 40 might actually need a facelift, neck lift. I just could never see someone in their 20s needing it. Typically, for me, like 50s is kind of when people really kind of start potentially needing facelifts. Sometimes in the 40s is too young. I don't know. It is getting younger. It used to be it was always older people getting facelifts. They are getting a little bit younger, but 20 years old, absolutely no. That's crazy. You know, another reason not to go out of the country to get your plastic surgery. So there you go. All right, we're gonna do one real quick little fun topic. This is kind of non-plastic surgery related. It's almost non-medical. Have you guys ever wondered why we need sleep?
No.
You've never wondered that. You've never wondered why we have to sleep. This is how my brain works. Like, I'll stay up all night wondering why I even need sleep in the first place. Like, what does it do? You know, it's like, I mean, if we were still in caveman times and there were dinosaurs running around and I had to lay on the ground for 8 hours, some dinosaur come eat me. Like, how from like a, you know, evolutionary standpoint is sleep even still a thing? You think of things that need to sleep but all be eaten by other things, right?
Yeah.
Or is that just me being crazy?
I think it's a little both.
Yeah. I think about these things. Like, what does sleep do? Like, what happens?
It does a lot.
Yeah.
You guys know? Do you guys already know this?
Yes.
Okay.
My friends that go to the airport at like 4 a.m., they're like, I'm just going to pull an all-nighter. I'm like, no, I'm not doing that because I just get paranoid about all of it.
So you think, so you know sleep is important. Do you know what it does though, Brenda? And I'm not like trying to put you on the spot.
It does a lot, I feel like.
It does do a lot.
Your brain needs it.
Okay. All right. So you probably like
your whole body. I think it just like regulates everything.
That's. I mean, you're.
If you don't sleep very well, you develop heart disease.
Yeah.
That is true. Also, you guys are very knowledgeable. Yeah, very good. Okay, I'm gonna break it down for you.
I am a sleep expert. I'd say I need my
because
my
you sleep a lot.
Sleep. Yes.
I actually don't sleep a lot. I'm not a big sleeper.
I wish I like didn't. I wish I was a morning person, but I'm such a night owl.
I wish I could sleep less.
If I go to bed late, if I go to bed early, I still am tired in the morning. Like
really?
I think women have to sleep more than men.
Is that true? Mm-hmm.
Okay. I believe it.
We're supposed to sleep more.
Really? I didn't know that. Is that because like some sort of like pregnancy thing or?
No, I think it has to do with how we function.
Hormones, yeah.
Yeah, I think our brains are.
Did you guys know that for most of human history we had no idea why we needed sleep? I mean, that was true. I mean, even when I was really young, I don't think they even. This is all kind of new data that's come out about why. What does sleep actually do?
Right.
You guys are all on the right track. I'm going to break it down for you guys right now. Okay, sleep does some very, very important things. Number one, body restoration, tissue repair, immune strengthening. Huh?
All the cells in your body.
Yeah, growth hormone release. It does all of these things. It's like
that's why I took Sermorelin. I took the peptide.
Oh yeah, I remember you telling me about that.
And it all has all to do with getting your rest.
Now this is a new one. Neurological cleanup. So there's a glymphatic, so not lymphatic, but glymphatic system which clears neurological waste. So that's like the beta amyloids, which is what kind of, clumps up when people have Alzheimer's. So actually that occurs in sleep where your neurological system is cleaning out that waste. Memory consolidation is a big one. When we sleep, our short-term memories are turned into long-term memories, which is interesting. I didn't know that one. And then emotional regulation. REM sleep recalibrates stress and mood. So sleep is like the body's maintenance crew. It's like our body's way of kind of stopping and just kind of repairing things. And so what happens if you skip sleep? You guys were saying it. Heart disease, yeah, that's a good one. Yep. Because it increases your cortisol, which is your stress hormone, increases blood pressure, increases insulin resistance, which give you diabetes. Your memory kind of goes to crap. Your reaction time goes to crap. Decision making gets worse. And you said it, chronic sleep loss is related to Alzheimer's. Or I said that one, heart disease.
Yeah.
Obesity and depression. So. And a third of Americans don't get enough sleep.
Right.
And I'm probably one of them, although I feel like I get enough sleep, but like by the definition of what's enough sleep, I don't.
Like my dad I swear, slept for like 5 hours. max.
Your dad? Yeah, I sleep.
Same. My dad is.
Yeah, I don't
crazy.
sleep. I don't sleep very much
so
either.
Late, wakes up so early.
Mine didn't go to bed early. He would just wake up like at 4 o'clock in the morning, and I'd be like, "Why are you awake?" He's like, "I don't know."
Like you were still out partying?
No.
He's like getting up in the morning?
I was a kid, but he'd be like, "You want breakfast?" And it would be like Saturday morning, and it's like 6 o'clock, and he's like, "I've been up for 2 hours," and I'm like, "Why?"
What are you doing at 4 a.m.?
Saturday.
So, some of the reasons Americans don't get enough sleep, caffeine, medications, screen time.
Yeah,
like
screen
Light. All of that.
Yeah. The hustle bustle culture of like always doing stuff and stress, So we always treat sleep like it's optional, but really it's arguably more important than things like nutrition and exercise. Because if you don't get it, like your body just shuts down.
Yeah.
If you don't get...
Well, like even whenever there's this thing called like CNS or something.
Central nervous system?
Yeah, like when you overdo it for when you work out. Like you can push yourself to the point of like damaging that, and if you don't get enough rest, if you don't stop, it'll just it'll cause your body to have all of those issues, all of those issues that you're talking about, not like heart disease immediately, but like forgetting things, being depressed, and when you overtrain, it causes stuff like that.
So it's like a similar effect to like lack of sleep.
It'll cause you to like if you just keep going and going without taking a beat. It does that.
What is interesting, and I've always wondered if I have this, about 1% of the population has a mutation in the DEC2 gene, and people that have that mutation can get their full allotment of sleep in half the time of a normal person and function completely normal. So there is a real thing. That's a real genetic abnormality that allows people to get about half as much sleep as the average person, which is kind of cool. I wish I could have that gene times 2 because I feel like I could get a lot done if I didn't have sleep. Huh?
How much time do you sleep?
I don't sleep a lot. Like 4 hours, 5 hours is kind of normal for me.
I track mine on my Oura ring. I think I've told you about
my
Oura ring. But it shows like the REM sleep, everything.
Yeah.
And I love it.
Yeah.
So.
Well, interesting stuff.
I'm trying to learn more about my sleep.
Cool. Well, hopefully this segment has inspired you to do a deep dive.
To do more sleep.
to sleep more. Sleep more.
She's like, I'm going to add another hour to my 8 hours.
All right, let me recap this one real quick. So today we kind of did a fun off-topic talking about why do we even need to sleep? It doesn't make sense. What does it do? And actually, for almost the entirety of human existence, we didn't know why we sleep. But research has recently, in the past years, decades, shown us what sleep does. So first off, it does a lot of cellular maintenance. Like it's a time when our body shuts down and starts to do repairs, increase growth hormone, and overall just kind of clean up our system. Neurological cleanup is a big one. There's actually a system called the glymphatic system, which removes neurological waste, so like beta amyloids, and that happens during sleep. Also very, very important is short-term memories are turned into long-term memories. For all those students out there, if you want to remember what you're studying, make sure to get sleep after you're done. And then finally, emotional regulation. It kind of resets our stress hormones and overall it kind of makes balance for us. So about 1/3 of Americans don't get enough sleep. There's lots of reasons for that: hustle bustle culture, caffeine, screen time. But we tend to treat sleep like it's just a luxury, but it is an absolute necessity, almost arguably more important than things like nutrition and exercise, because without sleep, our bodies will just shut down. So there you go. All right. Cool. Well, high fives all around. You guys did good today. Very engaged. Good questions. You guys are rock stars. And you know a lot about this stuff.
They're like my favorite topics, sleep and Taylor Swift.
Sleep.
And it's my age group, but I'm not involved in the plastic surgery.
Yeah. Very good.
Or
all right.
Facelift, I mean.
The facelift.
Don't get a facelift, Brenna.
I won't.
You either. You're way too young. It's like my age or older. All right.
Yeah.
Thank you guys so much for tuning in. We really do appreciate it. Please hit that like, subscribe button. Leave some comments. We'd love to know what you'd like us to talk about on the next episode of Nip Talk. See you next week.
Bye.
Bye.